Happy Friday! It's Dr. Bridget Young from babyformulaexpert.com coming to you live from vacation. Check this out, huh? Happy hour is unannounced and at a random time today because both boys are asleep at the same time. Amazing. And we're having a little birthday party for PD after this. My whole family's here and multiple people are talking, and I'm sure we'll start making fun of me momentarily, so just bear with me. So today I want to talk about a topic that is actually a question that's asked a lot by normal everyday parents, but is pretty controversial in the very snooty academic research world, and that is, when is the best time to introduce... Knew it was coming. When is the best time to introduce solid foods? Is it 4 months? Is it 6 months? Is it exactly 5 months because that's in the middle? So these are my musings and my thoughts on it. The reason it's controversial, amongst us snooty researchers, is because it's different for every baby. So the World Health Organization recommends exclusive breastfeeding with introduction of solid foods at 6 months. The American Academy of Pediatrics kind of wavers a little bit and says exclusive breastfeeding with introduction of solid foods between 4 and 6 months. And you should see how people get up in arms about this 4 to 6 month time, which is a little insane. But you are interested in only your precious and unique angel. So these are the things that you should think about to decide when is the correct time for you to introduce solids. The first is what you hear everybody talk about. Your baby needs to be physiologically ready to eat food, so they should be able to sit up well, like in a bumbo, hold their head up, swallow semi-solid food, not just liquid. These are things that everybody seems to know. If they choke and gag repetitively, scarily on food, they may not be ready. Nutritionally is what is more interesting to me, because I'm a nutritionist, and what is mostly different between babies. And here's what you need to know. It's different. Our nutritional needs of a 4 to 6 month old baby are different if the baby is exclusively breastfed versus exclusively formula fed. And here is why. Breast milk actually has very low, I'm getting like a huge glare, so I'm going to try to turn this, very low concentrations of iron. And it's designed this way. Babies are born with a huge surplus of iron in their body, and when they're breastfed, breast milk is the gold standard. They grow beautifully, and at about, between 4 and 6 months, that storage of iron in their body has been used up, and it's pretty important that they start getting iron-rich sources of solid food. Which is why I like recommending iron-rich sources of solid food. If you are formula feeding your baby, there is a ton of iron in formula, particularly in the United States. So your baby is getting a ton of iron. Come 4 to 6 months, they might be ready to have solid food, and you might enjoy giving some, but they're not going to need that iron in order to keep their hemoglobin levels in the normal range. So that's the biggest difference. And so if you're breastfeeding your baby, somewhere between 4 and 6 months, they're going to start needing iron from solid food. How do you know when that is? Well, there's a couple things that will let you know that your baby may need it sooner than others. So, like I said, babies get this huge dose. Like a million kids here. You're going to start hearing them. Baby gets this huge dose of iron in utero. So things that may set a baby up for a smaller, we call it iron endowment. So, to sound very snobby and elitist, your baby's iron endowment at birth may be a little smaller if these things are relevant to your baby. If your baby was born definitely premature, but even early, like a 37-weeker versus a 40-weeker, they cooked for 3 weeks longer. They got 3 more weeks of mom pumping iron into them in utero. If your baby was born and did not have delayed cord clamping. So babies get this huge bolus of iron right when they're born through the umbilical cord. And if you cut the cord right away from a C-section or just how your baby was delivered, they miss out on a little bit of it. If your baby gained a ton of weight, like they were born at the 5th percentile and by 6 months they're at the 85th percentile, they grew faster than a normal, the average baby. So they may have used up more of their iron stores growing so much. So all of those things, to me, like if you had all of those things, your baby was early, you didn't have delayed cord clamping, your baby crossed 50 percentile points, of course, talk to your pediatrician, but I might suggest that would be a baby you might want to introduce solid foods to on the earlier side, like maybe around between 4 and 5 months, if they're ready. Hello! If they're ready to eat solid foods, and be sure that they're getting enough iron. So introduce foods with iron. This is why cereal is a recommended first food. It's just because it's fortified with iron. I love meat as a first food, pureed, of course. Maybe I'll talk about best first foods in my next happy hour. So those are the things that you really need to keep in mind that are going to be individual to every single baby, which may help push you, which would push one baby maybe closer to the 4-month mark versus closer to the 6-month mark. At 6 months, really every baby does need to start eating solid foods just to fulfill even if they're formula fed, to fulfill their calorie needs, and also to begin they're growing into little people, exposing them to all the other wonderful things about solids that are irrelevant of nutrition. Meaning, like, you want to have them participating in meals, learning the coordination to put things in their mouth. They start off kind of stabbing themselves all over the place. All those wonderful developmental things that go along with solids that are irrelevant of nutrition. Definitely at 6 months, you want all babies to start experiencing these things, especially in the U.S. where we have safe, wonderful, solid food options available. So there's no danger. Let me see, I got a comment here. Please let me see. Andrea solid at 4 months. Andrea started being ready, but wouldn't eat it. No, she's 5 months old, and she would eat cereals but not purees. Interesting. So I hear this a lot where the comment is she started solids at 4 months and baby showed signs of not being ready but was by 5 months. That's perfectly normal. I always say, like, definitely the first month and definitely the first meal is way more all over the place. And if you get a good single swallow, you are on top of things. So it's a big deal. Do you think about the coordination of your tongue to swallow something when you've only ever drank liquid? So I think that's very normal. And if you think about how tiny babies are, like even if you are in that window where you think your baby may need extra iron, a little bit of food goes a long way because their stomachs they're tiny, tiny little people. So a little bit of iron can go a long way, especially if it's coming from a bioavailable source like meat. So it's okay. You don't need to worry if they're not eating huge amounts, especially like a 4-month-old versus a 6-month-old. That's a big developmental difference. The 6-month-old is going to be much more capable of catching on more quickly about how to swallow, get a spoon in your mouth, not just try to lick off of it. That's how all babies kind of start, and they have to learn. Are we still saying sure baby would only eat cereals but not purees? I don't have a perfect answer for that. Babies be cray and picky. And texture is a really big thing for some babies. So some will like a very fine puree with no lumps. Some babies kind of like more texture to their food, and that's just purely personality and preference there. And either way, your baby will get used to it. Eventually, you just got to keep trying. They'll start to get over some of their more bizarre preferences. So I'm gonna wrap up this happy hour because everybody's having fun. Also, I have to go frost Petey. Oh, we're having a birthday party for Petey this afternoon, so I have to go frost his cake. It's Cars themed, of course. So I've got to get to that. So if you know a mama who is thinking about introducing solids and hearing a lot of conflicting advice, which is stressing her out, which is like every mom ever, because like I said, there's a lot of differing opinions and some people are really passionate about this 4 versus 6. And I say, every baby is different. So some of those medical history things that are relevant to your specific baby will help direct you to whether or not they need solids a little earlier versus a little later on in that 4 to 6 months. How much breast milk are they receiving versus how much formula? Ooh, I want to point this one thing out too, and then we'll go, I promise. So I pointed out, I'm still getting this like sun in my eyes. I should have brought my sunglasses. Breast milk versus formula-fed babies have different nutritional needs, and iron will be very important to a breastfed baby starting somewhere in that 4 to 6 month period. Formula-fed babies in the U.S. get a ton of iron. If you are feeding a European formula, or if you are a European mama, so thus feeding a European formula, they have way less iron than U.S. formulas. Now, they still have more than breast milk, so European formulas kind of fall in the middle. So if you are feeding a European formula, or you have just been breastfed, and then now you are supplementing maybe with a European formula, that's lower iron. It's perfectly healthy, your baby's fine, but your baby may need iron from solid foods a little bit earlier than that 6-month mark, especially if your baby has some of those other characteristics that mean they have likely a lower iron endowment, like prematurity or early term, or not delayed cord clamping at birth, or mom, if you were anemic during pregnancy, or mom, if you had a massive blood loss during delivery. A, I'm sorry, that's horrible, but B, you lost a lot of blood, which means there was probably likely a little bit less of a push of your blood to your baby. All those things just set baby up to be fine, but just have a little smaller of a cushion of iron. So they may need iron, again, closer to the 4 or 5 month than the 6-month mark. Okay, so I hope I answered your question. So that's why we have variation recommendations, and that's hopefully how you can make a really educated choice about when is the best time to introduce solid foods, and then also the type of solid foods you introduce can really, meet their needs very quickly by serving iron-rich, nutrient-dense foods. Maybe I'll do happy hour next week about all different symptoms to watch for with low iron. Okay, symptoms to watch for with low iron, that's a great question. Most babies, at least in the US, at 12 months, which is pretty late, they will get tested for basically anemia. Your doctor will do a heel prick, test their hemoglobin level. If your baby is already anemic, they're pretty severely iron deficient. So, it's great to catch it, but before that, we would like to catch it before then. You can always ask your doctor to test for their iron stores, which involves a blood test, like an actual venipuncture needle. So a lot of moms don't want to do that. If you're really worried about it, ask. And there's things that we can test for that test for your iron storage levels and not just your hemoglobin. Other things to look for, it's hard to tell if you just have severe iron deficiency. It's hard because it's a baby, but it can result in fatigue. So kind of lethargy in your baby, if you notice they seem much less active than they were previously, much less engaging. Like if you put them on their play mat and they used to bat around and be excited, and now they just kind of lay there, without engaging or a lot of activity. That can be a sign. That can also just mean they're tired and they're going through a growth spurt, so don't panic. And eventually also a loss of appetite. So if you notice that, again, that could just be they've come off a growth spurt or they have a little cold, so don't panic. But, it's good to know these things to stack up with all your other individual baby's characteristics. And iron deficiency is very easy to treat. So it's not, I don't want to panic any moms. So I hope that answered your question. I hope this is helpful and clears up some of that confusion. Share it again with a family or a mom that's having trouble deciding exactly when and getting conflicting advice. Hopefully this will help. If I can help you sort out some of your feeding issues, obviously I'd love to work with babies who are starting solid foods too. It's one of my favorite phases because it's just so fun. And if it's your baby, it's your mess. And I just get to see the fun pictures. Feel free to set up a time to chat with me on my website, or you can do it right on Facebook. There's a tab where you can book now. I hope you guys have a wonderful day. Thanks for letting me squeeze in unannounced and at a random time. And I'm going to go frost a birthday cake. I'm so excited. I'll talk to you guys next week, and I'll just commit now. Next week I'll do best first foods and how that might differ for an individual baby. Okay, take care, you guys. Bye.